Good afternoon, everyone. Thank you. Good afternoon. This is indeed a celebration, so good afternoon.
Good afternoon.
Thank you. So, students, please be seated. Faculty, please be seated. So, good afternoon. I am Dr. Linda Scott, Dean of the University of Wisconsin-Madison School of Nursing. It is my distinct pleasure to welcome the families and friends of our 2022 graduating class. I am also pleased to welcome special guests who are with us today, including friends and supporters of the school. Members of the class of 2022, I am so pleased and quite proud to welcome you and your guests on this day, which marks the culmination of your educational journey. It is truly an honor for our faculty and me to celebrate your accomplishment and honor the critical role of nursing practice and research. This event reinforces the value of nurse leaders and nursing science in our lives, our communities, and our society. If you have not already done so, I hope that you will take a moment to look around, take a few deep breaths, and settle your mind from the whirlwind you have experienced this week and this semester. The students who will become graduates later today have been on a journey of learning, discovery, and growth. As you consider this milestone, I hope you will fully appreciate what you have had to manage to get here. Under the most typical of circumstances, doctoral education is incredibly challenging. You have had the added challenge of completing your doctoral degree during a pandemic and at a time when disruptions and injustice in society created additional stress. These things may have taken a toll on you personally. In addition, they certainly have changed the way you approached nearly all aspects of your academic life. From your remote coursework to maintaining strong peer and mentor-mentee relationships, to navigating the settings in which you conducted outreach and gathered data, you had to find new ways to do already difficult things. But I don't want to dwell on that. Rather, I want to acknowledge and honor that it took exceptional levels of commitment, persistence, and resilience to get here. It has been my honor to see you persist to reach this goal. I respect what you have accomplished. We share a passion for the challenges that can be met through nursing science and advanced specialty practice. I am grateful for the experiences, the knowledge, ideas, and personal conviction you will direct toward the future of care in our communities. You are now graduating into the next steps of your professional nursing journey, and doing so at the end of the week that is celebrated nationally as Nurses Week. Nurses Week falls on the same dates each year because it ends on the birthday of Florence Nightingale. I believe it is helpful to see Florence as a role model, not just because she is credited as the founder of modern nursing, but because of her comprehensive, systematic approaches to the practices and policies that assure proper care. Her legacy inspires scientists, clinicians, and caregivers, and those who believe in improving conditions for all. She was a social reformer. She was a gifted statistician. She was a writer. She was a nurse leader. As doctoral candidates, you are ready and prepared to build on the legacy of nurse leaders who came before you. Your potential to transform nursing research, education, practice, and policy are needed in the profession and society. Be confident that you can advance what is known about improving and protecting health for all people. Be willing to question, criticize, teach, learn, innovate, and continue to grow. Stay committed to transforming care, building equity, and improving systems. Prioritize the well-being of your patients, your colleagues, and yourself. As Dean, I am immensely proud that the School of Nursing will graduate more than 260 students this weekend. This includes 2 doctors of philosophy and 33 doctors of nursing practice that we are recognizing today. My colleagues and I applaud you for your decision to pursue doctoral education. You made a leap of faith that it would work out. Dedication, commitment, and resilience brought you here today. Your doctoral education was a journey unlike any other. We are all proud of you and will always want to hear about your aspirations, impact, and how you're doing. And so now, we would like to hear from two of our doctoral candidates who have been nominated and selected to share some thoughts with us today. First, I am pleased to welcome PhD candidate Nancy Veal to the podium. Nancy.
Thank you, Dean Scott. The journey to this day has been long, and the path has not been easy, but the reward of reaching a goal has been worthwhile. It is difficult to imagine this day without all of those who have helped me and all of you to get here. Yet some were not able to complete the journey with me, specifically my parents and my older sister, Steph, who left this world too soon. My parents taught me that education was essential and that you can achieve your goals if you work hard. You see, neither of my parents finished high school, yet they knew the value of education. They instilled the value of hard work and the importance of education in our family. And our family has been fortunate to have great parents who provided encouragement. I have now shared those values with my children. I started my journey at a community college in the mid-1980s and first started coursework toward completing my undergraduate degree when my youngest son was just 3 months old. He's 30 now, married, and on Saturday, May 14th, he will receive his master's degree from the University of Wisconsin-Oshkosh. Thank you to my family, friends, and colleagues who have supported this pursuit. I especially thank my husband, Greg, without whom I could never have survived. I am proud of my family and grateful that I have had the support and mentorship from so many in my circle to help me make this journey. And to my fellow graduates, although our academic journey is coming to an end, may we continue to be intentional and lifelong learners. Thank you.
Thank you, Nancy, for sharing your story and representing our PhD students. Now, please join me in welcoming DNP candidate Ashley Fielick to the podium. Ashley.
Good afternoon, fellow graduates, faculty, staff, family, and friends. My name is Ashley Fielick, and I am honored to serve as the Doctor of Nursing Practice Program's graduation speaker. 4 years ago, I embarked upon my journey as a clinical nurse specialist student. I have enjoyed learning from my incredibly talented, intelligent classmates and developed lifelong friendships. I quickly learned how supportive our instructors were during our rigorous program, especially when COVID-19 took root in our lives. Our instructors fervorously encouraged and supported our learning and ensured we were doing well mentally, physically, and emotionally. As our classes shifted from hybrid to virtual, we adapted to new approaches to our coursework. With perseverance, as well as family and friends' support, we made it to today's celebration. Our future is bright, and we will begin our practice managing an increasingly acute patient population. No matter how challenging our days are, it is important to remember what brought us to the nursing profession to keep us grounded. For me, it was my grandmother. She suffered a rare, incurable, and inoperable cancer. At 8 years old, I learned how nurses impact those we love across the continuum of care. My parents, Gerald and Jane Rush, my husband, Joseph Leon Felix III, my son, Joseph Leon Felix IV, and friends here today, personally helped shape the advanced practice nurse I have become. As our Doctor of Nursing Practice class progresses in our careers, we will partner with our PhD colleagues to put research into practice. Our common connecting thread is being Badger nurses, no matter where we practice. We did it. Congratulations to the class of 2022. Go Badgers, go Badger nurses, and on Wisconsin. Thank you.
Good afternoon, everybody, and thank you, Nancy and Ashley, for those wonderful and inspirational comments. And I really appreciate you sharing some of your personal stories. So the school is very proud of all of its candidates before us today and the contributions that each of you have made to the school and to the profession. And each of you carry a belief in the pursuit of learning for its own sake and throughout our lives as a service for the greater good. It's now time to make two special doctoral awards. The first is going to be the D&P Excellence Award, and the second is the Sidney Scott Cooper Writing Award. The D&P Excellence Award is presented each year to a student who demonstrates consistent success in all areas of the emphasis within the D&P curriculum. This includes clinical scholarship, leadership, policy development, and advanced clinical practice. Their achievement in at least two of these categories must be regarded as outstanding. Finally, the eligible nominee must have contributed meaningfully to the School of Nursing or our community through voluntary service activities that go beyond those required in the program. I'm very pleased to share that this year's D&P Excellence Award winner is Rachel Chenoweth. Rachel, please come forward. Join me at the podium. Congratulations, Rachel. Rachel is graduating from the psychiatric mental health track of our D&P program. She received her Bachelor's of Science in Nursing from the UW-Eau Claire in 2013. When she entered practice, she worked as a registered nurse in an outpatient pediatric unit where she discovered her passion for helping adolescents to cope with both anxiety and depression. While completing her D&P studies, Rachel worked as a PA or program assistant, as we say at the School of Nursing, with Dr. Ann Ersick on a research program focusing on children with medical complexity. She also served as a D&P representative for the UW-Madison Graduate Nursing Student Organization and is an active member of the American Psychiatric Nurses Association. Upon graduation, Rachel looks forward to becoming a board-certified psychiatric mental health nurse practitioner. Rachel, thank you for your contributions to the D&P program and our school. And again, congratulations on receiving this award. And Dean Scott will give you your certificate. The second doctoral award we'll present is the Sidney Scott Cooper Writing Award. This award was created to increase student awareness of opportunities for publication in nursing literature and encourage students to write for publication. Each year, all enrolled nursing students are eligible to submit a paper or a manuscript of published quality as a nomination for this recognition. The recipient of this 2022 Sidney Scott Cooper Writing Award is PhD candidate Nisreen Alumni. Please join me at the podium. Welcome, Nasreen. Congratulations. Nasreen was selected to receive this prestigious writing award for her published qualitative meta-synthesis as a first author, which I think is really important, first author of this article, in the Western Journal of Nursing Research, along with her dissemination of her scholarly work and research findings at multiple nursing conferences. Some of those conferences included the Midwest Nursing Research Society and the State of Science Congress on Nursing Research. Currently, Nasreen is finishing a manuscript related to a concept analysis of paternal bonding with premature infants. Findings from this concept analysis are the building blocks for her dissertation and future related research studies. Nasreen has been advised by a PhD studies by Dr. Tracy Snedden. Congratulations, Nasreen. And please join Scott.
The ceremony of convocation is important to all of us. It is important first to our graduating students. For them, it marks their incredible potential and their achievements. It becomes a turning point, a pivot from which they move forward differently in the world, confident in the skills and knowledge, and both ready and prepared to make a positive difference. The ceremony is also important to our faculty. For them, it is a time to celebrate achievements of the graduating students and to recognize the scholarly circle of life. Convocation is important, too, for advisors, mentors, and other supporters who relish the passing of this milestone for someone they have believed in for years. Finally, convocation is important for the nursing profession and the broader community. And regalia is central to all of it. The tradition of academic regalia is believed to have begun within universities in England during the second half of the 14th century and transferred to the United States. Institutions initially established their own academic dress codes, but by the mid-1950s, an intercollegiate code of academic dress was established. The patterns that you see here today are traditional, and they reflect our specific field of learning. The hooding ceremony itself signifies a scholarly and personal achievement. Our graduates today wear doctoral gowns with bell-shaped trim sleeves. The hood is placed on the student by an academic leader of the school to symbolize the passage of the individual from student to master. It is now time to recognize our candidates of our doctoral programs. Our PhD candidates are nurse scientists who will generate the knowledge and scientific evidence that shapes the future of care. Our Doctor of Nursing Practice program is designed to prepare nurse leaders as clinical experts in the discipline. Our DNP candidates will shape the delivery of care. Together, our graduates will deliver on the art and the science of improving health outcomes for all. So now we will recognize our Doctor of Philosophy candidates. Dr. Chris Queckelboom, Director of the PhD program, will recite the names. Each student will come forward as their name is called, and Dr. Queckelboom will read the student's dissertation title. They will be hooded by their faculty research advisor, receive congratulations from me, have their pictures taken, and then return to their seat. Dr. Queckelboom and PhD advisors, please join me at the podium.
It's my pleasure to introduce our accomplished PhD candidates for degrees. Nancy Joan Beal. title of Nancy's dissertation is Technology Acceptance in Nursing. Andrea Strayer. Andrea's dissertation title is Older People's Social Processes of Living with Degenerative Spine Disease.
On behalf of the faculty, please join me in congratulating our new Doctor of Philosophy graduates. We will now recognize our Doctor of Nursing Practice candidates. Dr. Pam McGranahan, Director of the DNP program, will recite the names. Each student will come forward as their name is called and the title of their scholarly project is read. Students will be hooded by their respective population leads. So as you see, Dr. McGranahan and our population leads have joined us at the podium. Dr. McGranahan.
Thank you. So we're going to hood our candidates in order of their specialty. So our first group are the Adult Gerontology Acute Care Track. And Chandra Norder-Brantley will be doing the hooding. So Anna Catherine Doty. And the title of Anna's excellent scholarly project was Improving Nurse Assessment and Documentation of Pressure Injury in Patients with Dark Skin Tones. Brenda Leah Alexson. Brenda's scholarly project was implementing best practices to reduce physical restraint use in the intensive care unit. Alyssa Holcomb. Alyssa's project was improving nursing education, assessment, and intervention to prevent respiratory device-related pressure injuries. Oren Jacobs. Oren's project was promoting emergency department uptake of the geriatric falls and mobility protocol. Allison Joy Johnson. Allison's project, Empowering the Front Line, a structured staff input program to improve nurse engagement. Tenzin Lamo. Tenzin project was community-based, evaluation of Tibetan Health Council and Health Information Center. Hasmeek Morales. was Meek's project, Identification of At-Risk Patients for Perioperative Neurocognitive Disorders and Multimodal Interventions to Reduce Incident Rates. Emily Tile. Emily's project, a second syphilis screening for pregnant patients. Garrett Williams. Garrett's project, evaluating supports provided to informal caregivers of people living with dementia admitted to a dementia crisis stabilization unit. Shander will also be hooding our 2 candidates from the clinical nurse specialist track. Ashley Jane Feelig. Ashley's project, developing processes to enhance cardiopulmonary resuscitation quality, guideline adherence, and clinician practice. And Kathy Walzak. Kathy's project, post-discharge phone calls for patients released from an inpatient medical oncology unit. Our adult gerontology primary care NP students will be hooded by Suzanne Wallace, their population lead. Catherine Bray. Kate's project, increasing nurse knowledge of electronic resources at Meriter Hospital. Alexandra Koch. Alex's project, using team steps to improve RN and NA teamwork and communication for happy prevention. Yeah. Emily Ruth Lichty. Emily's project, evaluating and supporting an individualized workplace wellness program. Hannah Lucille Tepsa Peterson. Hannah's project, improving symptom monitoring at Pleasant View Nursing Home. Nick Flume. Nick's project, evaluating documentation practices of nurses at UW Hospital, a review of the utility of surge documentation. Larissa Reinen. Larissa's project, creating a Wisconsin Medicaid policy to cover devices used in the treatment of glioblastoma multiforme brain tumors. Matthew Ryder. Matthew's project, infusion rate monitor use in oncology with peripheral and venous vesicant administration. Our next group of students are from pediatric primary care, and they will be hosted by their population lead, Tracy Saladar. Laura Bradstreet. Laura's project, enhancing pediatric readiness among registered nurses in an urban community emergency department. Rhiannon Gunther. Rhiannon's project, early mobilization in a surgical trauma pediatric intensive care unit. Erin Elizabeth Plew McMillan. Decreasing provider burnout and frustration through implementation of Epic Synopsis View. Rose Marie Mayo. Rosie's project, implementing an early childhood health consultation program in Wisconsin, outreach to early care and education providers. Samantha Faye Mazer. Sam's project, Wait and See treatment for pediatric acute otitis media, assessing rates of antibiotic usage. Danielle McClone. Danny's project, Human Trafficking Education in Wisconsin Pre-Licensure Nursing Programs. And from our last group of students will be the Psychiatric Mental Health track, and their population lead is Gina Bryan. Lisa Fick Vermont. Improving educational material quality and access for adults with substance use. Sarah Jo Brossman. Sarah's project, quality improvement of pain assessments in an inpatient setting. Rachel Phillips Chenoweth. Rachel's project, Project Sending It, safety enhancement through naloxone distribution and treatment safely. Alexandra DeFulvio. Alex's project, peer support groups to reduce burnout in outpatient behavioral health nurses at UW Health. Laura Ann Goggins. Laura's project, evaluation of drug treatment court in Marathon County. Michael Mady. Michael's project, improving discharge protocols to reduce Veterans Hospital psychiatric readmissions. And Padao Yang. Padao's project, exposure, relaxation, and rescripting therapy for Hmong patients with trauma-related nightmares. Congratulations, graduates.
So again, on behalf of the faculty, congratulations to our new Doctor of Nursing Practice graduates. As graduates of the UW-Madison School of Nursing doctoral program, you crossed the bridge from student to graduate, and you walk forward as an advanced practice clinician or a new nurse scientist. You have gone from being a member in a cohort to a member of a broader professional community. A community connected through the power of the Wisconsin idea and a shared commitment to the continual sifting and winnowing by which alone the truth can be found. We now turn our attention to your future connections as a Badger nurse. In just a moment, I will welcome Dr. Mary Francois, a former member of our faculty and current UW-Madison Nurses Alumni Organization board member, to join me at the podium. The NEO has a rich tradition with the school. It was founded in 1927, shortly after the first class graduated from our School of Nursing, and it has been a strong partner to advance programs and promote fellowship among alumni ever since. Please join me in welcoming Dr. Mary Francois to the podium.
Thank you, Dean Scott. Hello, and congratulations on your huge accomplishment. To all of you, on behalf of the UW-Madison Nurses Alumni Organization, I remember sitting in your spot just a few years ago. I was so relieved when I finally got my scholarly project completed. I remember the endless hours I put into that, and also I remember the weekends where I would take my hundreds of pages of my project and put them all over my dining room table and cross out paragraphs and cross out sentences till I got it to perfection so that I could turn it in and graduate. And I'm certain many of you are feeling relieved and gratified to have completed this very important journey in nursing. You have achieved the highest degree possible. So again, congratulations. It's a pleasure to welcome you to the UW-Madison Nurses Alumni Organization as you head into the next phase of your career as a healthcare professional, scholar, practitioner, and hopefully someday maybe a future School of Nursing faculty. The Nurses Alumni organization is open to all Badger graduates, and here's the good news: your membership is free. Our goal is to support activities that benefit nursing students at all levels of the educational preparation, and our primary function is to connect alumni with each other through social and career-enhancing functions, and all of our funds raised go to scholarships for all nursing students here at UW, and maybe one of you or some of you have been recipients of those. So we hope that once the dust settles and you are in your new role, wherever you're going to be headed, that you will consider becoming part of our Nurses Alumni organization by attending a function, mentoring one of our new graduates, or joining one of our committees, which we always will have openings for. So we truly believe it is a great time to be a nurse. There are positions and settings to work in populations wherever you choose to as a doctorate of nursing practice and PhD level nurse. Every day, society is privileged to observe nurses who are doing amazing and meaningful work. What we hope is that you look back at all the years that you spent here, maybe not now, but just understand the privilege of being a UW-Madison graduate. As Badger nurses ourselves, we are certain that you will be prepared to address complex health problems in innovative ways, strive to improve health outcomes, and will continue to challenge yourself to be a lifelong learner, clinician, and researchers. So just look for us on Facebook and Instagram under Badger Nurse Network and become part of our organization. So again, congratulations to all of you.
Okay. One more page. Again, thank you, Dr. Francois. Congratulations to the members of the class of 2022 and to the family and friends of our graduates who have been a part of your journey and supported you along the way. As you go forth into the rest of this celebratory day and into the profession, I encourage you to remember and exemplify that nurses lead, nurses collaborate, nurses advocate, nurses research, nurses innovate. We lead to the future of health for Wisconsin and for the world. Now, I ask our graduates to please stand. Thank you. Thank you for your work thus far, and thank you for the work you will continue to do. And faculty, I ask you to stand. Graduates, families, and friends, please join me in thanking the faculty. And I ask our staff to stand, who have been instrumental in the preparation and coordination of today's convocation. Staff, thank you. Okay. Now, it is time to move into the next phase of our event. I ask that our guests remain seated until all the faculty and students have recessed and a class photo has been taken. I will now lead our faculty, followed by our graduates, to the staircase in the atrium, where we will begin class photos. Once those have been taken, our guests you'll be dismissed to enjoy the reception and continue our celebration. Thank you again for being here with us today, for celebrating the success of our students, and as always, on Wisconsin.